I will say welcome to everyone. I'm glad that we were all able to get together in this format, and for those of you listening to this on a recording, welcome as well. So today we're going to give you, the format of the session will be, you'll hear me talk for the next probably 15 minutes just about our programs, and then we're going to do a breakout into some of our panelists who I'll introduce in a moment, who are current graduate students who will speak to you about their experiences in the school. And then we'd like to do a large question and answer period. So we've received some of your pre-submitted questions already, and we've got answers for you on those. But please take note of questions as we go through the session, and we'll be happy to, I'll either answer them myself or delegate to somebody who has the right information for you. I've just realized I haven't introduced myself. So my name is Samantha Meyer. I'm an associate professor in the School of Public Health and Health Systems, and I've just moved into the associate director role of our graduate programs. So the reason, our session, of course, the format is a little bit different today because of COVID and the pandemic, but also what's unique to this session today is we're giving you an overview of all of our graduate programs. So it used to be that we would separate our MSc and PhD programs from our what we call professional programs, so our Masters of Public Health, our Masters of Health Evaluation, and our Masters of Health Informatics. But we find we get a lot of questions from students about, or potential students about, the similarities or differences across the programs, which one is their, suits their need in terms of career goals or things that they're hoping to accomplish as they move throughout graduate school. So even if you do have your eye on an MSc or PhD or one of the other professional programs, it's good to get a sense of what we're doing across the school as one collective unit. Another transition or change that's happened over the last few years is really efforts in our school to have our courses that are offered for these various programs available to all students. So we really are trying to make some of our online courses available to our MSc, PhD students, as well as what our professional programs, as I'll speak to in a few minutes, are held online, but we do offer some of our courses in a blended format, meaning if you are able and willing and interested in coming to campus when the pandemic is over, there are spots for some of our online courses to be done in the classroom. So just be aware of that up front. So hopefully you'll get a lot out of hearing about all of our programs and not just ones that you're perhaps specifically interested in today. And I won't be monitoring chats because all I see is my presentation right now. So please do keep your questions coming. And as Leanne noted, she'll be taking track of them so that we can speak to them at the end of the presentation. So I've already introduced myself, but today, hopefully, well, once we open up to a panel discussion, you'll get to meet some of the other folks that are around the table today to answer your questions. Dr. Plinio Morita is an associate professor in the School of Public Health and Health Systems as well, and he's taken on the leadership of our recruitment. So he's somebody who you'll probably hear some more from in terms of recruitment activities, but also a faculty member with a really unique research program that he might mention today. So feel free to have a look at his profile and see what he's up to and all about. Brian Mills, Melissa Santo, and Eden McKeenan are incredible resources. We're so thankful for them. They've put together this PowerPoint presentation and will be your primary point of contact for questions about admissions. If you are to come to our program, they'll be your point of contact for basically any question that you have about process, curriculum, sequencing of courses. They're your go-to. So we're so thankful for our staff. And then we have 4 student representatives here as well. So Julia, Samantha, Milan, and Hoseldamin, who will be speaking to you today, as I said, about their experiences. So we've tried to ask students to represent the various programs today. So 2 of our students come from the professional programs and 2 from our research programs. If you haven't had a look at our website already, very valuable to do so. So I'm sure that you've had a chance to look at our homepage, but it's always a good idea when you're forming your application to think about what it is about the School of Public Health and Health Systems in this case. What about it is exciting to you? Why in particular might you want to come and study here? Particularly writing your application, we want to know why you want to come and work with us, what it is about our courses that are unique or interesting to you and have fueled your interest in working with us. So go ahead, peruse not only the content about admissions and about our programs, but also see who the instructors are, see who the staff are, get a sense for what our department's like. I think that we are a really unique faculty and a unique school in particular because of the breadth of topics that we offer. Public health is just such a diverse world that you'll hear from some of the students that speak today. You know, we dabble in so many different disciplines. So our teams are very multidisciplinary, and we span sort of bench to applied to social sciences. So we really offer a unique perspective, and some of the courses you take in your early years in your graduate studies really give you a flavor of the department, and you get to see the diversity. So please do have a look, see what we're up to and what we're all about. In terms of who or how many people come to our program, so I'm just looking here from my notes. We have roughly 50 to 55 MSc PhD students that are entered into given entry into the program a year. And our cohort of professional programs is a little bit higher with 95 to 100. Within that, you're embedded once you're in our program with roughly 200 research students and 400 in the professional programs based on number of students across the years as well as part-time versus full-time students. So you are in good company. We have a pretty tremendous intake, I would say, and a large number of students to draw on and to experience studying with. We also have three collaborative programs that are that function through the School of Public Health and Health Systems, but they have collaborative training opportunities. And so one is in aging, health, and well-being, and one is with the Water Institute at Waterloo. If you're interested in more information about these programs, it's available online, or you can inquire through some of the staff that I posted earlier on in the presentation. But essentially, they have degree requirements that are slightly different. So there are some unique courses that give you that designation of having this PhD or MSc in this collaborative program. I think our MSc is really unique too, in that we've identified these new opportunities for what are referred to as fields. So if you are interested in taking our research stream, so our MSc or PhD, we're able to designate you into a specific area where you can identify a field at the end of your, or a designated research field. So it's just a selection of courses that we've put together. If you're specifically interested in aging and health, for example, or in health and evaluation or health and environment. So that's a really unique piece in that because public health is so broad, you're able to specifically say, I've done an MSc in public health and health systems with a specialization in this particular area. So we've just established those within the last year to give students that opportunity to provide more of a tailored almost marketing of themselves at the end of their degree and more tailored curriculum to their level of interest. So our MSCs are 2 years. This is the research stream. So you're required to take 5 courses. 3 of them are core courses, and then you have the opportunity to take 2 electives. And we also have graduate seminar milestone programs that are really, really neat courses. I always say to students that are starting with me in my or in their first year, how these seminar courses are really about forming bonds with not only your classmates, but also your faculty. So you're exposed to various research areas by faculty and students that are in upper years. So you get a sense for what's going on in the research community. So a very, very good option in your, or very, very good opportunity in your first year. And then you have a master's thesis. So we have 2 different milestones related to the thesis. You propose what research you're going to work on, and then you defend it then at a later date. And I will give you an overview of sort of the trajectory in a moment. PhD, is 4 years. So if you're doing it full time, it's a 4-year program. We have 4 courses that are required. 4 courses, 2 that are core courses required and 2 that are electives. And this is over and above your MSc courses. So if you're enrolling in the MSc and then PhD courses, you'll leave with a total of 9 courses. We also have a milestone, which is a comprehensive examination that happens early on in your degree. And then you go on, once you've passed your examination, to do your doctoral thesis. The program trajectory. So in your first year, you're typically working on your courses. This is for PhD trajectory. Then you go on to do your comprehensive examinations. This is only for PhD students. Then you do your thesis proposal. And as I said, this is a formal milestone. So you're actually presenting a proposal that you prepare to do your doctoral research on. That has to be passed through a committee, and then you can go on to advance and do your actual doctoral research. And then you work on your thesis data collection, your analysis and write-up, and then you have a final defense. So this looks like a very short period of time, but this is spread across your 4 years. One the value adds or real strengths, I think, of our program is the opportunity for MSc students to actually fast track into their PhD. And so I've had a few students that I've worked with take advantage of this opportunity. If you finish your first year of your MSc and you think you really know that you want to do a PhD, you've done exceedingly well in terms of your grades, you've had some opportunity to do some research and decide that this is the path for you, and you have a supervisor who's willing to support you, you can apply to do a fast track in July of your first year of your MSc, and that takes you directly into your second year of your PhD. So you essentially treat your first year of your MSc as your first year of your PhD. So it shortens the clock for you considerably. This is often an option, I think, for students who haven't had enough research experience that they're perhaps eligible for our PhD program, more competitive, I should say, directly coming out of their undergrad or even after a period of employment. And there's students that they kind of want to test the water and see whether or not grad school is their thing, whether or not they really want to invest that time and make sure that they're happy with the program and they're feeling comfortable. So a really great opportunity that I say, I've had, I think, 3 students now that have taken advantage of this opportunity. And it's a great option to consider if you're thinking, research might be the place that you want to be, but you're not totally sure you want to commit to applying for a 4-year program. So all of this information around application requirements is available on our website, but essentially you need to have a 4-year honors bachelor degree for our MSc with a minimum of 75% average, 2 academic letters of reference. You'll have to write a 500-word text, and at the end of this presentation, I'll give you a list or a place where you can go to learn a little bit more about writing that statement of interest, and then a writing sample. So this could be something you prepare fresh and new that you want to discuss something you're particularly interested in, or you could pull something from your undergraduate degree or place of employment that you've written just to give us a sample of what your writing is like. An important consideration and a question I'm told we get quite often is about supervisors and whether or not you need to have a supervisor confirmed before your application process. What we suggest, we advise that you at least have contacted a supervisor. You have an indication that somebody might be willing to work with you or interested in your work and that your areas of interest align with theirs before you apply, but you can work on establishing that relationship throughout the application process. Certainly by the time your application is starting to be reviewed, you want to have somebody on faculty who has offered to review your application at least, or better yet, to supervise you. The PhD application requirements, so we ask for a completion of a master's degree and evidence of prior research achievements. We often get the question, do you need to have a master's with a research component? That's no longer required. So if you've done a course-based master's and you're looking to enter into our PhD program, you don't have to have a thesis-based master's, but we do want to see evidence of substantial research. So you may have worked on a side project in research, you've authored a paper or worked as a co-author on a paper. We want to see demonstrated research capacity as well as, and that allows us to assess the potential for research productivity in future. A minimum of 75% for your average. We ask for 3 academic letters of reference for the PhD program and a similar statement of interest, a writing sample. And the PhD as well, you're required to have somebody who's identified as a potential supervisor if you were to be admitted to the program. So in terms of application, I've got some information here. It's also on our website. So make sure you've got all your documents in line, you've got your letter of intent written, you've got a potential supervisor. Make sure your referees have confirmed that they're willing to provide those references before the deadline. And as I say, if you have questions, please don't hesitate to reach out to us about these programs. I'll provide I have an email address for you to contact at the end of this presentation. And now we turn to our professional programs. So they're course-based programs. So our MPH, our MHE, and our MHI all have different course objectives. As I mentioned earlier, these courses were traditionally developed for an online offering, and they still are offered online, but there is opportunity to take some of these courses in person with the on-campus students if that's something that you are interested in, but certainly not something that is required at this time, with the exception of courses I'll speak to in a moment where we do have an on-campus component. So for our MPH degree, it's 2 years of full-time study or 4 years of part-time. We often see with our professional programs many individuals who are coming back after being away in the workforce or doing this part-time while they're working, taking care of families with many responsibilities. So we have a higher proportion of students, I would say, that are doing it part-time for the MPH specifically, but we do request that, or people are required to come to two on campus. So at the beginning of your degree and at the end of the degree, we all gather together in usual times, pre-pandemic and hopefully post-pandemic, to be on campus together to do two courses. There are 9 additional core courses and then 2 electives that you take. And then another really unique feature I think about our MPH program, or maybe not unique, but really valuable in terms of thinking about career progression and where you want to head, is our practicum. So I don't have the list of their names on this PowerPoint, but we have 2 points of contact who will be very valuable to you in the future if you're looking at doing your practicum. One is our practicum advisor, and one is our practicum coordinator. And so these are individuals who will help you to establish and set up practicums where you'll get valuable firsthand experience in public health and have sort of tangible outputs when you leave the program and contacts. So below are some of our course requirements. I won't read through them in detail, but again, all available for you online. The MHE is approximately 1.5 years of full-time study and 3.5 of part-time study. So there are less courses involved in the MHE, 7 and 2 elective courses, and again, that practicum opportunity. And for the MHI, similar timeline to the MHE, as well as the practicum component. So there's a lot less detail, I think, provided about the professional programs because they are online and they don't have that research component. But I should say, if you are interested in doing the MPH, MHE, or MHI, there's always opportunity to participate in research as well. So again, our programs, we have 1 school with 5 graduates, and there's opportunity to get involved in research if you're so inclined as part of your professional program. So please never hesitate to reach out to somebody who you might be interested in their work and just see what opportunities there are to engage in research. And likewise, if you're doing an MSc or a PhD, there is opportunity to get course credit for practicum placements if it's something that you want to pursue. So that is available as well. It's just not something that's typically the pattern of the students that we've seen coming through that program. So for the MPH, MHE, MHI, you need to have a 4-year honors bachelor's degree, again, an average of 75. 1 year related experience for the MPH and MHE. So related experience may be co-op placements that you've had. It might be 10 years out in the workplace that you've had. It might be volunteer experience. There are various types of experience. So I would say in your application, it's to you to make a case for why you have experience that's related to that degree. And in the MHI, experience is considered an asset in your application. I'll let you read through the rest of the application requirements because I want to make sure that we have time at the end for questions and that I can get through all of your lists. But providing your CV, highlighting your academic, professional, and volunteer experience, as I said, is a really important piece. We want to see what it is that's driven you to want to apply to this program, what experiences you've had that have led you to that, and what you're thinking of doing moving forward once you graduate from our program. Also requiring 2 reference letters similar to the MSc. And so if you're interested in applying to these programs, please visit the website, take a look at all of the documents and things that you'll need to have ready before you apply, and just be aware that our submission deadline is February 1st. So beyond this week, there's some education sessions that might be helpful for you. In addition to our staff and myself and Plinio, who I introduced at the beginning with regards to recruitment, you can feel free to reach out to us, but we also have, there are some sessions available that might help to support you in writing your application. So please keep these dates handy as the PowerPoint says. Screenshot this slide for your information. And make sure to attend these if you're able to. I don't know, and maybe Leanne does. My assumption is these will be recorded, but I don't know. Leanne, are you aware of whether or not these sessions will be recorded for people who can't attend them?
Yes, they should be on the TSPA website.
Brilliant, thank you. Okay, so we have 2 separate emails provided here. If you have questions about admissions, so I've provided the one for MSc, PhD programs, and then for the MPH, MHE, MHI. I just warn, it's not a warning, just be aware. We are, of course, in uncertain times right now. So many emails are flying around. Everyone's administrative roles are at an all-time high, so please be patient with responses to these emails. We want to hear from you and we're here to help. We'll do our best to point you to anything that's available online, but if you are emailing about admissions, just expect perhaps a 2 to 4 day response time, but certainly know we will get back to you. We want to work with you. It's just things are a little bit overloaded at the moment. So I think what I might do is close down the PowerPoint. Just one moment. Hey, everyone. Leanne, am I still sharing my screen here?
You are.
All right.
There should be maybe.
Oh, I got it. I got it. Good. Okay. What I'd like to do now is open up to our graduate student panelists. I've asked in advance if they would provide just sort of a 3-minute snapshot of who they are, what program they're in, why they chose that program, and kind of what their hopes are in moving forward. So for those of you who are kind of undecided in whether or not you'd like to apply to one program or over another, or what some of the potential opportunities are for students once they've graduated, this might help to give you a little bit of an overview of the experiences of our existing students. So I might just start with Julia, please. I'm just going to go in order of the PowerPoint presentation. So Julia Goyle is a PhD student in the school. Is Julia here?
I am.
Hi, Julia. Thank you. I'll stop sharing my video, but pop back on when you're done.
Okay, sure. Can you see me? Can you hear me?
Yep, see and hear. Thanks.
Perfect. So yes, so I'm Julia, and I began my third year as a PhD student at the School of Public Health and Health Systems. My PhD is a little different. It's joined with the Department of Mechanical Engineering. So it's a bit different, and I'll talk about that later. But my interests lie in the intersection of work, health, and technology. So just a background of where I've come from and how I ended up at Waterloo. I did my bachelor's in biology with a minor in economics at McMaster, and then my master's at Waterloo under the supervision of Dr. Ellen McGacken, where I studied the health and safety of Airbnb. So around the time that I was finishing up my master's, my grandma was actually back in India. And so I was seeing firsthand the caregiving challenges that come with older adults. And in India, they have a very different nomenclature for these symptoms. But here, those symptoms would be very much dementia. But back home, they were saying it was just old age. Anyway, so seeing that and seeing those challenges, I really wanted to dedicate my PhD to this sort of work. And so currently I'm working on using mixed methods, both biometric and qualitative data, to create a machine learning model for worker behavior. So of course, I decided to pursue graduate school because of course I had a very clear vision of what I wanted to study and how I wanted to study it. But something that I really want to highlight today is why I chose Waterloo. So we are really, really lucky as students here at School of Public Health to be able to work with such great staff and faculty. My supervisor, she has been such a great support to me. A story that I don't often share, but I thought I'd share just to sort of illustrate the sort of faculty that we have and how open-minded they are. In research, there are often two camps of researchers. It's qualitative and it's quantitative. And my supervisor is very much an extremely talented qualitative researcher. And her research has informed and has played such a key role in shaping various work and health policies, whether it's at the city level, province level, Canada, even internationally. And so at first, being a very, a very strong qualitative researcher, she wasn't very pleased, to be honest, with the idea of me trying to merge this quantitative side in my work. But because our relationship was one that's full of respect, full of trust, and it's so strong, we talked about it and we had a lot of chats about it. And she could see my passion for the project. She saw the support that I was getting from other people. She was able to see the value for this type of work, and she came around. And to be honest, she has been my greatest cheerleader, both for this project and all my other crazy ideas I've had before and after. And it's a project that got me actually selected as a national finalist for Vanier last year. And I was successful for SPHHS last year. And now I'm the first joint PhD student actually at the University of Waterloo. And so that's only a possibility because I've had such a great support system around me, both at the department level, at the faculty level, and even higher up. So Jeff Cosello, his team at the Graduate Studies and Postdoctoral Affairs Office, they've been such a great support, and they really do work around the clock to make sure that our experiences here are as great as they can be. So as much as I attribute my academic success to these resources and to these supports, I think my experience is also a great testament to the importance of getting involved and really carving a place for yourself on campus. And so it was through these networks, so whether it's work on various committees on campus, whether it's being a graduate student senator, whether it's being on the board of governors, whether it's my work as an RA on these really multi-province and multi-stakeholder projects that I've had a chance to work on, whether it's being a fellow at the Institute of Work and Health in Toronto, and there's so many other examples. These networks have really propelled me to go further in my academic endeavors, and much further than I thought was possible. And so these experiences have really prepared me for what lies ahead. So currently I'm planning and I'm leaning towards more politics and consulting and more of the startup sort of world, maybe academia, but right now that side seems more attractive for me. But I think something that I just want all of you to keep in mind too is that whether you choose U Waterloo or not, and you definitely should choose U Waterloo, I think it's really important that you keep an open mind and you follow your passions, and then the rest will come after that. And so if you have any questions regarding any of my experiences or just any help that you may need, whether it's applying for grad school or anything else, please do feel free to reach out to me. My email is julia.goyle, GOYAL, @uwaterloo.ca. So thank you.
Thank you so much, Julia. I really like that you were able to examples and personal experiences just to demonstrate our faculty here, because I too think that we work with just such a wonderful group of people. I hear time and time again how supportive and collaborative faculty are, and I see that firsthand, but I think I'm really glad to hear that out of from students as well, so thank you. Is Sammy Chown here?
Yes, I am.
Hi, Sammy. So Sammy is an MSc student in the school as well, who's going to give you an overview of her experiences.
Okay, so hi everyone, my name is Sammy Chown, and as Sam said, I am an MSc student, and I'm investigating mental health in emerging adults with learning disabilities under the supervision of Dr. Mark Farrow. I did my undergrad degree in kinesiology, and I minored in religion and diversity at McMaster. So having a diverse background, I chose this program because it was one of few public health programs that had an applied research component, but was distinctly interdisciplinary. And so more specifically, my focus is epidemiology and biostats. And with this, I can use my knowledge from coursework and my thesis across different disciplines in health. Also, I found that all the faculty and staff I communicated with during the admissions process were kind and supportive, and I felt welcome before I even began my degree, and that has remained during my time here. So that's kind of an overview of why I chose this program, but on a smaller scale, I really wanted an in-person experience, and this program offered that. With my MSc, I hope to secure a job as an epidemiologist. So again, through my coursework and my thesis, I've had many opportunities to build my knowledge base and refine my skills. And I've also had the pleasure of working with faculty members who are epidemiologists, which has allowed me to build a professional network. And lastly, an opportunity that I have had that allows me to work towards these sort of future plans of mine is my current position as a student rep for the Canadian Society for Epidemiology and Biostats, or the CSEB, which is an academic society on a national level. And being that student rep, I'm not just a student voice, but I'm also widening my network and learning more about epi and biostats along the way. So things that I really enjoy about this program, I find that the staff and faculty are motivated and committed to their students, and a support system who care about your academic, professional, and personal success is exactly what I needed, because I didn't have much research experience before starting here. You know, as I'm learning and evolving in research, I found that I've had so much support. On a personal level, I really enjoy being the student rep for the School of Public Health and Health Systems, a graduate student association, because this gives me the opportunity to advocate for students and work with faculty and staff in different capacities. So that's kind of an overview of why I chose the program, what I'm hoping to do with it, and really what I love so much about it.
Thanks, Sammy. And Sammy, I'm really glad you mentioned the graduate. So for all of you listening, our GSA is a really active group who does all sorts of, as Sammy said, advocating work and working for students and identifying any student concerns that need to be moved forward. But they also organize a lot of fun events, things that make the culture on campus and online more enjoyable. They facilitate and foster relationships across students and faculty and staff. And they just make, I think, life on campus for students better. So students interested in applying to the professional programs as well, the GSA is also there for you. They're doing more and more, as you can imagine, online activities. So definitely something to look into if you do choose our program, or one of our programs. Is Milan here?
Hi, yes.
Hi, Milan. Milan is an MPH student. Thank you, who is going to give their overview of the MPH experience.
Okay, thank you. Okay, hopefully everyone can see and hear me well. My name is Milan and I'm a full-time MPH student. So I began this degree only a year or so ago in August 2019 with my cohort, and then plan to graduate in fall of 2021. I am excited to say by this point that the bulk of my coursework has been completed to date, and I'm currently in progress of my last two full-time MPH courses. So we'll be pursuing my practicum in the winter semester. I chose the University of Waterloo's online MPH program for various important reasons. I'd like to, mirror what people have said about the staff being incredibly supportive. All my professors have been so great to date. This is an online program, so I haven't really felt that disconnect at all. Not that I was worried to begin with, because everyone, again, was warm and welcoming before I got here. But the reason I chose this program first is that it's a highly accredited program, and I was very honored to be selected to it and have the opportunity to attend. I have been a public health nurse for over 8 years, so a few of my colleagues had also undertaken the program, and so I knew it was reputable and it would help me achieve all of my learning goals and help me to endeavor upon new career paths. I don't know which path I liked this program because it gave me a taste of so many different, we do have some courses in health evaluation and epidemiology. I kind of knew I wanted to work in my passions of the social determinants of health. Mental health and addictions was another thing I was very interested in. I just knew I wanted to move above and beyond the frontline delivery of public health programs, which is what I was doing as a public health nurse. So for my practicum, I know as of this point, I would like to apply towards roles in health policy and program planning. Those have emerged as my passions throughout the program. And I just know whatever I decide to embark upon first after I graduate will be a worthwhile journey and gaining valuable experience. Ultimately, my overall dream is to take all I've learned here and apply that to executing effective public health programs or policies, and further help motivate teams and services towards achieving social justice and health equity. The second reason I chose this program is because the flexibility of the online formatting was key for me. I liked that I would be able to be self-motivated, work from wherever I needed to be with work and or family commitments. And also you would I found out upon embarking upon the program, I haven't needed to, that you can switch between full-time and part-time depending on what your other commitments are. So it's very balanced with, you being a professional and a person first. In some way, I have enjoyed every single course to date and all my professors to date, even though they haven't, really emerged every course as my passion, or, I've been dedicated to everyone and learning as much as I can about it in that short period of time. They're very relevant, engaging, and comprehensive, even through online delivery, and I'm feeling very adequately prepared for my next steps. Even online group work, a few courses more than others has online group work, has been great because I was able to develop so many connections with my peers during the foundations course. So I hope they continue to offer that. I know with COVID, they might be thinking about different formats or delivering to different formats, but even recently through online meeting platforms and conferences, it's really gone to show me that you don't need to be with people to work extremely well together and develop bonds of friendship with others. Lastly, with the introduction of COVID, this program, which has been offered for years online, had never flinched or wavered, and that gave me a great sense of security in my education. Also, after COVID began, you kind of already knew an MPH was going to be a very relevant sector and career path, and I do look forward to contributing to Canada's collective health overall for years to come. Thank you for your interest in my journey, and I'm happy to answer any questions or further concerns you may have.
Thank you so much for that overview. And I think especially highlighting the online nature and that I wanted to, which I think you spoke so nicely to, was the nature of the online content. I think, we offer excellent online programs that are really designed with students in mind in terms of engagement, interactivity, making it flexible for people who have other commitments, work, family, whatever else it might be. And I teach an online course. I teach Health 608, which is offered for MPH students. Well, it's offered to all of our graduate students. And in the design of that course, we really put together thought about how to make it fun for students, interactive with students, and most of our online courses have built-in discussions that involve networking and making groups with students that are in the course. So you still get that sort of working in your own time, but getting to engage with others and making it more of a community feel. So thank you so much for speaking to that piece. And last but not least, I'm looking for Hosaldamine. Oh, sorry, I'm pronouncing that incorrectly.
Hi, that's me.
Hi, I'm sorry. Can you you can do your introduction? My apologies. I'm from our MPH program. We were supposed to touch base in advance, and I didn't have a chance. My apologies.
It's okay, no problem. So my name is Hossam Eldin, but it's two words. It's by mistake. It's misspelled, so it's one word. But you can call me Hossam.
Thank you. Great.
So thank you very much for giving me this chance to speak about my program. As I said, my name is Hossam. I have a background in medicine. I practiced as a physician for quite some years, and then I pursued my career in the medical administration. I worked also as a medical director, and the reason I'm saying that is that I wanted to pursue my career in the field of administration in the health sector. So that's what I chose, Master of Health Evaluation. I was also very excited about the practicum opportunity that was in a lot of options and apply what I have learned with hands-on training in the field of evaluation, whether it is program evaluation or policy evaluation. I had a very good experience with my practicum. I'm extremely interested as well in mental health. I work as a side as a mental health coach and addiction counselor. So I chose my practicum, which was perfect for me, that it was a student mental wellness program in the University of Waterloo School of Engineering. And it was a very good mix between the mental health and the program evaluation. So this is one of the reasons I chose the program, because I knew about this program even from outside Canada. It's very famous because of the practicum opportunities that puts my feet on the beginning of the track that I want to pursue. The healthcare system in Canada, how it compares to other countries, and what are the pros and cons of it, and what are the potential areas of improvement in the healthcare system that the government is working on. Especially during the times of COVID. I'm sure that's a lot on the government's plate to do in the coming few years. I'm also looking for opportunities in the government sector of health, where the government is doing some evaluation of the current health issues, current programs, current policies, etc. So what I like about this program, I will echo Samantha and Milan as well, that the most amazing thing about this program is that it is designed from day one to be online. And the reason I'm saying that is that I hear a lot of students saying that during the COVID times, shift to online, many students have been like confused. The content wasn't fully to be delivered online. This one is not. This one is designed to be online. So I experienced absolutely no difference before or during the pandemic times. So the content, the assignments, the time frame are all designed to be online, and they are perfectly designed. The professors are phenomenally supportive. This really exceeded my expectations, even though everybody say, we're sorry, during the COVID times, we might not reply to your email, but this is not actually what I found. Professors are extremely supportive. They are responding very fast to anything whatsoever. Just a professor last Sunday replied to email of mine like 5 minutes. So the support is amazing. The content choice and the design of the program is extremely intelligent and very smartly put together. So the content, the choice of the courses, they are extremely relevant. There is absolutely nothing redundant in the program that you don't feel actually that it is related to what you want to study or related to what you want to work on later on. So, and the default course organization, even and order, is designed in a way that makes you feel more and more at ease as you go. So you gain experience from this course to apply to the next course. You gain experience from this semester or term and apply to the next one. It's absolutely brilliant. So as you go, and more legible even. So finally, this is why I chose the program and what I want to do with my career. And finally, if I have a chance to recommend few points to the newly joining students, is that I recommend them to go and explore the website, the portal, and the Learn portal. It is amazing. Like every day, I'm discovering something new, something that helped me schedule myself, my assignments, new ways of communications with my peers, with my professors, with my TAs. My second recommendation is that don't be shy to ask the professors. They are, as I said, and I will always say over and over, that extremely supportive. They want to see you ask a question. They want to clarify. They want to make you feel more at ease. And also one of my experience, it's an excellent and brilliant resource. You can go to the university on the campus, attend few things there. It will really help you improve your writing and communication skills. If you have a problem with writing an essay, writing an introduction, writing a thesis, if you have a problem referencing or in citation, as I did, and I learned a lot from there, that's also a great resource. So thank you all for giving me the chance to share my experience. And I'm also very happy to answer any questions down the road. My email is hbakir@uwaterloo.ca. Thank you very much, and thank you, Samara.
Thanks, Hassan. I really appreciate it. And thank you for pointing out the resources on campus. We don't have a lot of time, so I won't get into them, but a very, very supportive campus with lots to offer for graduate students. We do have one final panelist that was able to make it in the end. Janet is from our MP. Well, and if Janet is there, it would be wonderful if you could say hello. We may have lost her again. Janet?
Hi there.
Oh, hi. Hello, Janet.
Hi, I'm Janet. Everyone can hear me? Hello?
Yes, yep, you're good.
Okay, so I'm Janet, and I'm first semester the Masters of Public Health Epidemiology program. What drew me to Waterloo? One of my friends encouraged me to look up this program, and I was really happy in less than a few minutes. One, I wasn't required to submit a GRE record. I did not need to come to campus. It was online. And I looked at the core courses, and the core courses was very encouraging based on what I've done at York University with my undergrad in a bachelor's degree in health management, that is. And I pretty much like the idea that I can work full time and do this. Give me 1 second. But I'm getting interrupted by my fax. I'm so sorry about that. I like this program for a number of reasons. Now that I'm first semester and I heard my colleague talk about as you go along, it gets easier. I'm really looking forward to that. And as one of my previous colleagues said, with the group assignment, you really do feel like you have a structure, you have a team. I am finding that. I'm taking one of my favorite course at this time is our research methods. In that course, we have a format of a think tank weekly. And what we do is we summarize the module as short as possible, one statement, what we learned. And it's a really good transferable skill to have, to be able to say a lot in just as few words possible. I'm getting much better at that. As I see my colleagues do, some other groups do even better than I do, and I strive to improve that. What else can I talk about? I did not want to do a thesis. I wanted to do course-based, but from the way I'm seeing the course-based do, it's very encouraging in terms of getting experience and the practicum. I'm looking forward to the practicum. Things I do not like, sometimes I'm a little confused and I feel a little overwhelmed with the workload, but I realize that there's nothing I'd rather be doing. I'm so happy doing this program because it aligns pretty much with what I come from and what I hope to be doing. I got interested in public health when I worked with Global AIDS program in Guyana as an accountant, and meeting so many of the people there who had their masters in public health, public administration, epidemiology. And from then I decided this is what I want to do. I came to Canada and here I am. So that's it for me and where I want to go. I hope I can get back to an international program where I would be able to work as a program coordinator. I hope to go outside of Canada. I'm not looking forward to working within Canada, but if I do, that's okay too. Based on my experience, I love working in tropical country and I hope I can get back there. Regarding the workload, I do agree with my colleagues. It's manageable working full time and studying. There is one other thing that I really like, the pebble pad, the evaluation. It helps me to see where I'm at, and from the courses, the way the courses are being presented, the modules, I'm able to figure out, okay, what are the areas of the competence that I'm getting from which course, from which module. With each module, I can clearly get that. So that is, I'm kind of feeling secure that, you know what, I'm doing the right thing. I'm going along the right path. I am getting what I came here for. Don't think there's much else I can think of at this time. Yeah, if you have any questions or concern, you can always email me at Janet. No, it's jtiwary@uwaterloo.ca. Yep, that's it for me.
Thank you so much, Janet. We have, and I should mention, Janet, and just so that's a tool that we use online to help MPH students with tracking some of their competencies. It's a really unique, neat feature, but I guess just demonstrates, again, the quality of the online programming that we offer. I'm going to start going through the questions. If I can stick around for a few minutes after, if other folks are able to, but we'll see how far we can get with the time that's left over here. So I have some of the pre-submitted questions that some of you sent in before the session today. So I'll go over some of those. So the first is there any possibility of obtaining a PhD in public health and health systems fully online? So outside of COVID, students are expected to be on campus if you're in the MSc and PhD programs. So although you have access to some of our online courses, it is expected that you be on campus for those courses, so they cannot be completed online. What kind of careers do your PhD students often get into? Are they mostly academic job, or is there program flexibility for different career paths? Certainly students go into academia in the form of postdoctoral fellows and then more formal academic roles, but many students go in, they become scientists at relevant organizations. So in industry or in so many of our students go into working in hospitals or working with health organizations in terms of data scientists, analysts. Many go into consulting. So Julia spoke about going into into consulting practice. So certainly there's no one career path. I'd urge you to reach out and see if you can, particularly if you're interested in the MSc or PhD program, and there's a specific supervisor that you're looking to work with, ask them if they'll contact some of their graduate students on your behalf and see what, where they're headed, or even contact you or put you in contact with some of their former PhD students to see what they're up to and what they're doing, so you can get a sense of where those students typically end up. What is the duration of the PhD? So as I'd mentioned, it's 4 years or 12 terms for full-time, and 7 years or 21 terms for part-time students. How did you know an MPH was the best choice for you? Well, I'm hoping that some of you who have that question were able to glean some of a response from some of the student experiences. How can I be a stronger candidate for the MPH? I would say across the programs, have a look at our admissions criteria, look at what we're looking for in terms of students, and think about what it is that our program, why it suits you. So when you're writing your letter of intent, that's where you can really let yourself shine. Tell us about who you are, your experiences that have led you to why you want to apply, and what about our program is specifically interesting to you. How is the MPH different from the BPH? Well, our BPH is the bachelor, so the undergraduate degree, where the MPH is the upper year degree. Both programs are mapped to specific competencies that align with public health, but the MPH is, of course, at a higher level. I'm currently studying for an online MSc in public health. Would an online master's be acceptable for application? So yes, if you've done a course-based master's and are applying to our PhD program, you are eligible, but just need to demonstrate that research experience. So showing us some kind of evidence of research experience in the past that will demonstrate competency or the ability to conduct research as part of your PhD. Do you need to secure a supervisor? I had mentioned that one already. You don't need to secure one in advance of your application, but we do suggest, or you do need to have a supervisor listed on your application who ideally would have accepted to review or at least or supervise your project once the application process the admission process is commenced. Does the program offer specializations? So as I mentioned, we have collaborative degree programs, we have our research fields, and then we also, our Masters of Public Health is aligned with the public health core competencies. So hopefully that helps to answer your question. How can I make myself a more competitive applicant? So again, it's really about writing that letter of intent, seeking out the resources that I've provided in supporting you to write that letter. Make sure that you seek out strong reference letters, and when you're getting reference letters, ask them to not only sing your praises, but to offer examples of your strengths. So if they can draw on specific examples that you've done in the past in working with them or demonstrated on your resume or CV, that would be really helpful. Is it important for students interested in SPHHS graduate programs to do a thesis in their undergrad? You don't need to have done it applying, but again, if you're thinking about doing research, so you're wanting entry into our MSc or PhD programs, I always suggest it's a good opportunity to dabble in research, see if it's something that you'd be interested in, and certainly then you have evidence of research for discussion in your application package. How should a student choose between a thesis-based and a non-thesis-based graduate program? Sitting down and thinking through the different program requirements, what it is you're eligible for, but what it is you want to get out of the program. So in reviewing the different pieces of information on our website about the different programs that we offer, what suits you, what suits, where you are right now and where you want to be at the end of your degree? What is it that you're looking to get out of a graduate program? I had another point to that, which was thinking about the research component. You might be someone who's not interested in doing the research component in the MSc. So it might be that one of the professional programs is more in line with what you're interested in doing if you want to go more into practice-based work. Oh, there was a question later on too about, I know some people, we often see students who aren't certain, so they'll apply to the MSc and the MPH, for example, or the MSc and the MHE. I strongly advise you to craft those letters differently. Speak to the programs in a different way. I know there's uncertainty sometimes, and you might want to, spread yourself to have that opportunity that if you weren't offered admissions into one, that you have the other, or if you get both, that you have the option to choose later down the line. But you definitely want to show the admissions committee that you're serious about your application, that you've invested time into looking into our programs, and that you're applying with a purpose. So you really want to show why that specific program suits your needs, or why you're interested in that specific program. What was the cutoff average for last year in the MSc and MPH program? Yeah, an answer to that is really we do look at more than grades. So things, don't focus so much on your grades. Do the best that you can. Make sure you meet the minimum entry requirements, but we're really looking to see grades as well as reference letters, as well as your letter of intent, as well as your writing sample. But I don't have specific details on those cutoffs. In previous years, how many students apply for the MSc program versus how many people are admitted? Our admissions are very competitive. It's hard to say, what the cutoffs are, or how many students apply versus how many are admitted. It varies from year to year. So each year our admissions numbers are different, and we have, increases or decreases in applications. Again, I would just stress, write your application as strongly as you can, get the best letters of reference you can, just market, sell yourself in a way, show us your strengths, and also why it is our programs that you're really interested in, and seek out answers if you've got questions. What is the difference between an MSc and SPHHS with a specialization in health informatics and the MHI? So the field option of the MSc is less in depth. It targets optional courses, so you're actually required to take what might be an elective for some other students, whereas the MHI is a course-based master's that occurs online, and the curriculum has been developed specifically so that you have a degree in health informatics. Since we are naming, so we're 2 minutes over. If people have to leave, I completely understand. No worries, but I will go through the remainder of the questions that are listed here. So if you have to jump off, no problem. Thank you so much for being here. Okay, since we are naming our volunteer and work experience on the application, is it necessary to talk about all of them on the statement? Yes. I mean, we look at your CV and your details, but definitely if there are things that you want to be front and center, highlight them on your letter of intent. So share with us those experiences. So we want to certainly see them when we receive your application to say, yes, they have relevant experience, but if that's going to be a strength of your application, definitely make sure to highlight it. The website for the MPH program states that students should have experience in the public health setting, but it doesn't specify the amount of time required. I want to say that it's at least a year's experience. If I am incorrect about that, can someone please let me know? I think that's what was on our slides. Okay, no one.
Hi, Sam, I can jump in.
Thank you, Melissa.
Yes, hi everyone, it's Melissa Santo. I'm the Professional Graduate Programs Coordinator. Over the last 2 to 3 years, we've had some adjustments to our admission requirements. So the preference is still that students have a minimum of, or that applicants have a minimum of 1 year experience in that particular field. However, the admissions committee is aware as well that that's a wide variety. So the hope is that the information on the website is encouraging people, as Sam has mentioned, to put their best application forward and to really just present as much strength as they can, pulling on a collection of experience from where they've had it. But ultimately, we do look at the application in a full package.
Thank you so much. That's very helpful. Thank you. I told everyone to jump in if I was giving information. They're so much more knowledgeable about this. Thank you to Melissa and Eden and Brian. The next question is, in order to apply to the MSc program, do you have to have a specific idea right away? I get this question all the time. It applies to the PhD program as well. As I noted earlier, you need to be able to identify a supervisor, and because public health is so broad, you definitely want to have shared interests with the person that you're going to be working with. So you do need to enter in with a strong enough idea of what field you want to work in. So whether or not it's in epidemiology and infectious diseases, or it's in gerontology, or it's in microbiology, because we are such a multidisciplinary team, you do have to have a rough idea. You don't have to have a specific research question, so it doesn't have to be as specific as that, but you'll want to work with the person that you're hoping will supervise your MSc or PhD to solidify some ideas so that you have some sort of direction moving forward. So it's not binding. It doesn't mean it can't change. There have certainly been instances where students have come into the program and thought, whoa, this thing I learned in seminar was so interesting, I want to change courses. I mean paths rather than courses, but I want to change paths and go into a different space. And we can help to facilitate that if we can find you a supervisor that can guide you in that area. But it's definitely a good idea to have a path for that. I've got a question about whether a pharmacy degree can apply for an MPH. Yes, Melissa's populating this for me as I read it. You just have to meet the minimum requirements. So as long as you're meeting the applicant requirements, yes, you can apply. I have a question for Sammy. Is Sammy still here? She might have had to jump off.
I'm here.
Oh, hi, Sammy. So you mentioned you did not have much research experience going into your MSc. Would you mind discussing what experience you did have? And the second piece of that is to the professors, what research experience do we typically see in admissible students? So admittable students. So Sammy, do you want to talk just briefly about maybe what your application held?
Sure. So in terms of research-specific experience, I did do a research practicum course in my undergrad where I worked primarily with a PhD student, but it was a bit more hands-off compared to some of my other experiences in kin. I'm trying to remember, I think I had, it was very long ago. It feels like it's very long ago. I think I had a little bit, well, I did more practical experience, I would say, than research-based experience. So I was a TA throughout my undergrad for second, third, and fourth year in the anatomy and physiology labs. So that was one thing. And then I did, because again, kin is much more, I guess, in the field, let's say. I was an athletic therapist for varsity teams for 3 years as well. So in terms of research, I did a practicum, and I did volunteer in different capacities. But these weren't sort of solely research-based, but I would say that I was able to use a lot of the applied work that I did to better understand, my particular area in research, if that's helpful.
Great, thanks, Sammy, so much. I appreciate it. And on the professor side, I see students, think about any opportunity you've had to do research. So it might be that you've done an undergraduate thesis. It might be that you helped out as a research assistant, either through a co-op or a volunteer experience, a professor or someone on faculty that you've worked at. It might be that you did, some students have done a research course, so they might have done a qualitative research course or done a stats course, and as part of that they did a project where they collected some data or analyzed some data. So feel free to to pull bits and pieces from your different experiences for when you're looking at the MSc. I think I answered the next one, which is just about if you're applying to more than one program, please make sure your statement of interest does differ and is tailored towards that program. There was a question, I think it was answered in the chat already. Yes, Leanne answered it, just saying we do for practical, or so for professional program students, they do not have specific supervisors they're tied to, but we do have an overall MPH, MHE, MHI program, a faculty advisor. So we do have a one point of contact person that you can go and treat or work with as you would with a supervisor who is a faculty member. Is it true that most MPH students that are admitted to the program already have a professional degree or high experience? I'm worried about that since I'm coming right out of the BPH. That is a concern we hear all the time, and I think there's more and more interest in the MPH program for individuals who are coming directly out of their undergrad. So that's not going to be an issue at all. One of the advantages of our MPH program is that our students have a very wide range of backgrounds. So many people do come, like Milan, come from a professional background and are working full-time or part-time while they're taking this program, but some are coming directly out of their undergrads. So there's a lot of value, I think, an added asset to this program is that you do have many who are returning or coming back to study to advance their careers or to establish more skills or competencies. Students who have less formal working experience may want to collect formal or informal, speaking to your volunteer experiences, and it will make it Melissa, I think, is writing this, is saying it'll make it easier for you applying to practicums as well. So if you are applying to the MPH program or MHE or MHI direct out of your undergrad, you do want to document any relevant experience and then keep track of that as you're progressing throughout your degree. But certainly not going to be a problem with admissions. It just makes for a much more interesting discussions when you have your online discussions as part of your coursework. This one Leanne has already answered in the chat. Given the COVID-19 pandemic and the loss of in-person classes, what would you suggest would be a good way to connect with professors? So we're all working online, and just as I am from home, and probably more readily accessible sometimes by email. So if you do see a profile, well, what I would first suggest doing is looking through the faculty profiles, seeing whose work aligns with yours. Read some of their papers, check out some of the work that they've done, see what you can find online, and then reach out to them and explain to them why it is that you want to talk to them. So we get many emails from interested applicants from all over the world, and I respond to all of them, but the ones that come to me that have no personalization or relate to my field of work are ones certainly that I'm more likely to dismiss. So make sure that you're saying, I'm so-and-so, I read your work, here's what I'm interested in doing, I want to apply to Waterloo, and here's how I think that our interests align. That you've done your research and you're making the most of their time. So definitely reach out by email and ask them, just share with them a little bit about yourself and see if they'd be willing to set up a time to chat on Zoom or Teams or the phone or even just back and forth through email. What is the acceptance rate for PhD for 2020? It's hard to answer. It's really going to depend on the strength of the applicant pool. So how many applicants we get and how strong those applicants are. Do you find that SPHHS undergrads have an easier transition or advantage within the master's program? Yeah, so the transition is probably easier just because you're familiar with, staff and infrastructure and the learning platform, familiarity with the area. In terms of the content itself, I don't think I don't have any evidence to support for or against that, but I think that it's a really wonderful group of people, and certainly I can say this anecdotally, at least from my students' experiences. Your first year in the program, cohorts are just very close and very tight, and there's certainly, to me, hasn't been any sort of Waterloo undergrads versus others. It's been a very, the Graduate Student Association and all the events and all of the opportunities to meet through collective courses on campus and online. It's a really wonderful group of people. So, yeah. I think that that's why, no, Leanne is saying that is the end of the questions on the chat. If there is anyone that has anything outstanding to say, one of the panelists that want to make comment or address anything I've said, please do so now. We are 15 minutes over, but that's not terrible. I thank you all for sticking around if you've been able to do so. And as I say, we have awesome staff, awesome grad students. I'm a faculty member, so I won't speak on our behalf, but I think we're pretty great. So please reach out if you have questions, and thanks for your time today. Okay, I guess I'll end it there. Thanks, everyone.